Hello, everybody. James, Detroit. Thank you for joining in. I am going to read an article for you today. Story time, as we like to say, and I know Ray would be excited about that. If you think for 1 second, when you hear people talking, especially in the mainstream media, sometimes in these types of venues as well, something extreme, like saying that the Democratic Party has been taken over by socialists. And if you are sitting there and you believe in America and you think that you voted for Joe Biden and in Michigan, Gary Peters, and that the Democratic Party in, let's say, Genesee County, Michigan is old school, blue collar, for the working guy, and it's about the American principles, you say to yourself, you do not believe in burning the flag, defunding the police. You do not believe in these extreme ideologies of the Democratic Party that you see in Washington or someplace that's far away. Folks, I'm going to tell you right now, the things that we have learned through this last year, 2020 has become so enlightening. At least for me, it has. If you want to go back into the library of James Detroit and find out all the revelations we've had, whether it's certificate of need in the state of Michigan, whether it's understanding just how quote unquote COVID patients, and now we understand everything is a COVID patient. These are not one-offs. These are not anomalies. When you go to the hospital, you're listed as a COVID patient. Why? Because the hospital can get more money. Now, is it possible that you walked in and walked back out and, I wasn't listed as a COVID patient? It is possible. But the number of people that are reporting that they were listed as a COVID patient because they were in a motorcycle accident, or the people that were dying that are fighting to get the death certificate changed because the hospital, and this is just in Michigan, and it's other places too. We also know that the misreporting on things, the disinformation, seems to just go one way. The censorship just seems to go one way. Well, here's something that I just read. It's the title of the article is that the new DC law would give vaccine decisions to 11-year-olds and cut parents out. And I thought, I'm going to have to read this because I can't believe it. Washington, D.C. or not. But here we go. Charlotte Cuthbertson writes, Washington, the nation's capital city is looking likely to pass legislation that would allow children as young as 11 years old to make their own decisions on receiving vaccines without parental consent or knowledge. Bill 23-171 would allow for children as young as 11 to consent to all vaccines on the government schedule. At the same time, the school health care provider and the parent's private insurance would conceal the child's vaccination from parents or guardians, who would have no knowledge of the vaccination unless the child told them. The bill states that the minor must be capable of meeting the informed consent standard, end quote, which would be determined by a physician. The legislation was first introduced on March 5th, 2019, with a public hearing on June 26, 2019. The bill then sat until October 7th this year, when the 4-person health committee revised it, passed it, and brought it to the full council for a vote on October 20th. It passed resoundingly 12-1, and now heads back for a second reading and a final vote on November 10th. Oh, that was yesterday. Before landing on the mayor's desk for a signature. The primary sponsor of the bill, Council Member Mary Shea, said on the October 7th meeting that the current pandemic has given the measure more urgency. Given our ongoing pandemic and the incredible work being done to develop a COVID-19 vaccine, it's more important than ever, I think, that we reduce any and all barriers to these treatments. And this legislation aims to do just that by increasing access to the vaccines for minors who choose to get vaccinated but have not been able to do so, end quote. Councilmember Tran White, the lone dissenting voice during the October 20th vote, said his objection is to the removal of parents from the decision. Huh. Pat that gentleman on the back. Quote, "For me, it's not an issue of the vaccination. It's an issue of the council voting to circumvent the inclusion of a parent making the decision about their child," White said. "Medical practitioners, schools, and others should not be permitted to coerce or press minors into procedures that are capable of causing injury or death behind the parent's back," end quote. Again, seems like common sense to me. White said he wouldn't want his own 12-year-old son making unilateral decisions about his health when the boy can barely put together a 5-page paper or finish his homework on time, and he's frequently up late at night playing Fortnite. Mary Holland, general counsel for the Children's Health Defense, said she expects swift legal action if this bill passes. Well, let's hope so. Quote, "This is essentially cutting parents out of the equation of their children's health care," Holland told the Epoch Times. "I think this is extremely dangerous, and I think parents across the country will be able to perceive the danger that this represents, not only to their children, but to their rights as parents. If the school knows better, who's to say the parents should be the custodians," end quote. Holland has fought against the elimination of exemptions for mandatory vaccinations for children, especially those who are medically fragile. Children's Health Defense is currently fighting vaccine mandates in California and New York, as well as being part of the team suing pharmaceutical company Merck for allegedly causing severe injuries with its Gardasil vaccine. Almost all of the District of Columbia school children are adequately vaccinated, following the government's recommended schedule, according to Anja Talwalkar, the Senior Deputy Director of Washington's Department of Health. Talwalkar said that of the 123,000 school students in the district's public schools, 58 students had medical exemptions and 179 had religious exemptions from some or all vaccines. The new bill would be able to circumvent a parental consent for their child to opt out of a vaccine based on the religious exemption and conceal that from the parent. Quote, "This bill is not likely to increase community-wide vaccination coverage in the District of Columbia, which is the priority at this time," end quote, Talwalkar said in a 2019 hearing. Under existing D.C. law, minors over the age of 12 can consent without parental permission to healthcare and medical procedures, including mental health, contraceptive services, prenatal care, and abortions. Once again, the Enlightenment continues about how far left these democratic city centers are. Back to the article. However, the existing law, almost exclusively related to sexual issues, is narrow compared to what the new bill would open up, said Dawn Richardson, Director of Advocacy for the National Vaccine Injury Center, which tracks vaccine-related health issues. The Centers for Disease Control and Prevention said it receives about 30,000 vaccine injury reports each year. The reporting system is voluntary and estimates suggest it captures about 1% of all adverse effects, according to a report by Harvard Pilgrim Healthcare, Inc. Most of the reports are for mild side effects, but the CD says 10% to 15% of the adverse reactions include permanent disability, hospitalization, life-threatening illness, or death. Currently, the government immunization schedule recommends a total of 72 doses of 16 vaccines for children. Vaccines aren't subject to double-blind, placebo-controlled studies, which are considered the most scientifically rigorous. Instead, they're usually tested directly against other vaccines without a comparison to a non-vaccinated subject. Richardson called the D.C. legislation neglect, predatory, and criminal, and believes it contravenes Supreme Court precedent that puts a parent or guardian at the center of the decision-making process for their child. She said a child isn't likely to have at hand their family medical history or their neurological history, or even if they had a reaction to a vaccine as an infant. She is concerned that if parents don't know their child received a vaccine, they won't be able to connect the dots if the child falls ill. Richardson said it's wrong to allow an 11-year-old to take a biological pharmaceutical product that is something that could cause injury and death and has federal protection to protect the provider and the manufacturer from any liability, end quote. Vaccine manufacturers are protected from liability, and patients who have reactions must instead go through a special federal government court system for vaccine injury complaints. Shea said on October 20th that people who oppose certain vaccines, quote, believe that it's just their choice, end quote, but argued that community protection is a disease more important. Quote, maybe this legislation can be the vehicle to look at some of the larger issues about vaccination in terms of enforcing the law with respect to children attending schools or providing other remedies that may have to be put in place to make sure that we have the highest level of vaccination that would be possible, end quote. All states already have some sort of mandatory vaccination schedule for children to attend school, and states would likely have the legal authority to mandate a vaccine on their populations during a public health emergency or outbreak of a communicable disease. Generally, the power is held by the governor or state health officer. In all states, exemptions can be provided for medical reasons. All states but California, New York, West Virginia, and Maine also provide for religious exemptions, and some also provide for philosophical exemptions. Should District of Columbia Mayor Muriel Bowser veto the bill, the council has the numbers to override her with a 2/3 vote. The final step for the bill is a 30-day waiting period in the House of Representatives, a unique requirement for the District of Columbia. In an unlikely move, the House could enact a joint resolution against the bill, which would also need the president's signature to override it. That article is beyond enlightening. It should scare every parent that in a city center as powerful as Washington, D.C., this is the mindset. This country was created for individual freedoms, individual rights, the right of the individual to own property, make my own decisions. There is no greater decision that I have authority over than what I decide to put into my body. This is beyond a slippery slope. This is already happening. 12-1? Folks, they're talking about mandatory vaccinations for the COVID-19 respiratory pathogen that I believe is legitimate. I also believe that there's substantial evidence that it was created by the Chinese Communist Party, unleashed on the world. It's a pathogen that the CDC's own numbers of the 100 people, for every 100 people that supposedly died with COVID, only 6% of them died from COVID. Basically, the law of large numbers is telling us, as far as we can tell, 99.9% of the people get COVID, survive COVID. If you have pre-existing underlying comorbidities, you are more likely to die from this. What does that mean? You're obese, you have COPD, you have diabetes, you have 1 foot in the grave and 1 foot on a banana peel, and it would suck to get this, but so would it. The flu can kill you, so can pneumonia, and most of the people are 78 years of age or older. I am not about to give up my individual freedoms in the name of public safety for something that is not killing everybody. When people tell me, but James, we had more people die in a 6-month period in this country than ever before. Okay, well, 75 years ago, we had more people born in this country than ever before. And from 1945 to 1965, we had more people born in this country than ever before. It's the largest segment of our population until just recently. And it's the largest segment of the population that day over day, year over year, for the next 20 years is going to be the highest death total as well. We have had numerous viruses, naturally occurring viruses, throughout our history. When you compare the deaths per population from the Spanish flu in 1918, 1919 era, 100 years ago, we are not losing as many people. We happen to now believe that we need to rely on the government for every aspect of our safety. This article should, and look it up. It's in the Epoch Times, the November 5th through 10th edition. Look up that article. The new DC law would give vaccine decisions to 11-year-olds. Every parent should be outraged at this. But this is what's coming. I don't know how this election is going to end up. I was asked by a couple of people, what do you think? What do you really think? Well, I really think that there's beyond anomalies. I really think that there's beyond voter fraud. Even when it is proven, you don't know how the results are going to be. And I don't like the odds. I don't like the ability for us to be able to prove something different at this point, which is the shame of it all. You've successfully destroyed the integrity of a process that is so important to the constitutional republic, and that's the voting process. You know, I said it earlier, this apparatus that's recording this will be in conversations. We'll be talking about gutters. We'll be talking about go-karts. It doesn't matter what you're talking about. If your phone is on, it's listening. And next thing you know, you start getting ads for these things that you were just having a conversation with a couple of guys sitting around for lunch. These phones are listening because they're programmed to do certain things. Do we think for 1 second that this electronic vote counting process cannot be, that it's beyond any possibility of being programmed to do certain things? Just in Michigan alone. Oh, it's just a computer glitch. Oh, no, that was just human error. Oh, no, those machines weren't plugged into the internet. They weren't being sourced by any other oversight or anything else. There are more than a few things that we need to get to the bottom to. From a mostly libertarian perspective, I'm not a fan of the Republican Party. I'm certainly not a fan of the Democratic Party. I am a big fan, a huge supporter of Trump's policies. His policies have been the greatest policies of any president in my lifetime. But if I really want a more Ron Paul-esque governance, Trumpism to the next level, is it better to get a second term from Donald Trump right now through a legal process? Again, it's not the Republican Party that caused this issue. The Democratic states caused this issue. They are trying to get your mind to conform to ideas that it can't be changed, that the election's already done. It's conditioning your mind to believe that no matter what happens, oh, Donald Trump's trying to steal the election. In officiating, if we're in a football field and you commit a penalty, but then you get the ball and you run down and score a touchdown, you don't get to score the touchdown. You can't score with dirty hands. You stole the ball. It was illegal according to the rules of engagement. I don't know what's going to happen for sure. If I had to say, I would say 80% chance that Joe Biden is going to come out of this election process, as dirty as it may be, and be declared the president after December 14th. Only a 20% chance that Donald Trump will. But if the Senate is held by the Republicans, and the majority has shrunk significantly in the House of Representatives, then I think it's the best opportunity that we could possibly ask for from a libertarian worldview. So for all of you who didn't vote for Donald Trump and decided to vote for Joe Jorgensen, maybe this could work out. But a libertarian is never going to run this country. I know I voted for him before. We should be grateful that we have a two-party system that is so dominant. Many countries in this world only have a one-party system. But if we keep the Senate, pick up the seats in the House, it looks like is going to happen. In 2022, I think that you will see even more movement toward, I'll tell you what, when Senator Manchin in West Virginia, I don't know why he's still a Democrat. He keeps saying that we need to get back to legislating and governance from the center of the aisle. That's not your party anymore, Senator. It's not your party. And for any of these people in the state of Michigan that keep saying, oh, we believe in the right, the sanctity of life, the Second Amendment right. The fact that Donald Trump, through executive order, made it even more difficult, if not impossible, through the Mexico City rule of going out and actually having taxpayer dollars pay for somebody to leave the country to get an abortion. And you're going to erase that. Joe Biden's going to erase that. He's going to erase and put us back in the Paris Accord. And our energy costs are going to go up. I like paying less than $2 a gallon for fuel. That's a direct savings to me. That's a tax break right now. I'm going to tell you, we're going to re-enter a nuclear deal with Iran. We've already sent them 150 billion out of planes on pallets. We're going to do it again? And you think, oh, that's hyperbole. That's never going to happen. The fact that in that Democratic presidential debate, when Joe Biden was asked, can you executive order and eliminate the Second Amendment? And he gave a polished 47-year career politician's response and said, no, it would take legislation. And Kamala Harris started laughing, and she got a huge ovation for saying, we can, just say it, Joe, we can. I think with these extreme measures that are going to take place, more people will move from the Democratic Party because what they've realized is for the last 50 plus years, the Democratic Party has been lying to them. Their unions and telling you to support the Democratic Party because they believe in us, when an open border and NAFTA was killing the union medium wage from increasing. The two biggest issues, an open border, which is lack of immigration control, and NAFTA. And President Trump was attempting to eliminate that, to give all of us working class Americans the best opportunity to increase our medium. I don't know how this is going to turn out, but for all of those that voted for Joe Biden and said he's a moderate, it's not going to get that crazy. Look at these articles. These are things that are happening. The reinstitution of critical race theory and a Marxist ideology that it is mandatory for government employees. Corporations, the major corporations in this country, they have their man. His name is Joe Biden. Right now, he's leading in this election process. If he gets in, if he does secure it, Wall Street could never be happier. The money from Wall Street banks supporting Joe Biden versus supporting Donald Trump, we're close to 100-1. And yet all you heard on NBC, MSNBC, CNN, ABC, CBS was how Wall Street, he's a New Yorker, Wall Street, everybody wants Donald Trump to win. He's for the rich guy. Folks, pay attention to how these parties have shifted. The Republican Party is the party that is responsible to the working class, middle and lower income America. The policies that did more for us in a short period of time, even in the face of absolute obstruction. This is crazy that you'd give an 11-year-old the opportunity to circumvent their parents, especially for a pathogen. And these are the Michigan Health Department's numbers. I want to remind you of this because this is how important this is. During the peak of this pandemic, through July 31st, the state of Michigan, according to the Michigan Health Department's own numbers, 1 14-year-old or under was accredited to dying from COVID-19. 1. 8 14-year-olds and under were accredited to dying from the flu. That's Michigan's own numbers. I'm sure they'll change it at some point, but that was reported from Michigan in August. The flu was 8 times more deadly to 14-year-olds and under in Michigan, and yet you're wanting to shut down schools, change the world so that we can protect the most vulnerable. And yet what do we see? Suicide rates at its height for young people. Child abuse at its height for young people. The first line of defense is the teacher to help the children that are suffering from abuse. And we eliminated that aspect of that child's life. And guess who is tapped in this, quote unquote, getting ready to get ready for transition, is the Michigan. A person from Michigan with these kind of numbers, and this is how we're going to look at governing our country. I hope you'll share this with somebody else. My number's 5. Share it with 5 people. I've got 41 subscribers on here, it looks like. That's what they say. I don't know how much longer I'll stay on this channel. I think BitChute and some other things are out there because Big Tech's got their guy now. They censored all of us for this entire election cycle. But you can tell every lie you want about Russia and the Mueller investigation. Folks, start doing the research. And for all of you, because I know there's more people out there that have witnessed voter fraud during this election cycle, step up. Do the next right thing. We need to secure the integrity of one of the most important aspects of our constitutional republic. And it is to believe in our elections. Believe that my vote is actually going to be counted and not erased by a warehouse, unknown, after everybody's gone home. Can't match up signatures. Don't follow the rules that I followed. I went in, showed my identification, filled out the paperwork for my request for a ballot. They verified that my signature on the ballot request that I just filled out in front of them and my identification, the signatures matched. They gave me a ballot. I'm James Detroit, and for now, I'm out.